So bring it back and start again.
Hello and welcome to this edition of One-to-One Podcast. Today I'm focusing on the medical sector, particularly nurses taking English exams. There are two parts. The first will help you pronounce essential vocabulary that you will need for an exam. The second is the listening task to help you identify with spelling. Good luck with the tasks, and remember, we help you prepare for the IELTS and CELPIP exams. The tasks featured in this podcast will help you with some of the tasks you will be expected to complete in both these exams. Listen carefully to the following vocabulary. Patient, patient, patient. The patient had a medical condition. Nurse, nurse, nurse. The nurse administered the vaccine. Doctor, doctor, doctor. The doctor wanted a second opinion. Hospital, hospital, hospital. The hospital was only a 20-minute drive from the city centre. Clinic, clinic, clinic. Outpatient care is available at the clinic. Surgery, surgery, surgery. The patient underwent surgery for a cancerous growth. Medication, medication, medication. Medication is only available on prescription. Diagnosis, diagnosis, diagnosis. A biopsy is needed before a diagnosis can be made. Treatment, treatment, treatment. Outpatients must go to the treatment centre between 8 a.m. and 7 p.m. Medical record, medical record, medical record. The app provides a medical record for patients. Wound, wound, wound. The wound needed to be cleaned before being assessed. Intravenous, intravenous, intravenous. Intravenous medication acts faster because it flows directly through a vein. Catheter, catheter, catheter. A catheter is a tube inserted directly into the body to drain fluid or administer medication. Rehabilitation, rehabilitation, rehabilitation. The patient was prescribed with a 3-week rehabilitation program. Palliative care, palliative care, Palliative care. Palliative care improves the quality of life for patients with serious illnesses. Pediatric. 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 The pediatric department looks after children who need treatment or care. We're going to start the listening task, so listen carefully. The text is available on the website, one-to-one-academy.com, and if you're listening on Spotify, then check out the links in the podcast description box. If you're listening elsewhere, then check our profile for details. In the next section, there is a short story. Listen carefully and answer the questions below. Sally was a patient at the Royal Crescent Hospital in London. She was involved in a car accident and underwent surgery on her left arm for a torn ligament. The medication was very strong and she was advised not to drive. Initially, her doctor prescribed an intravenous drug, but that was later changed to a tablet form when she had a follow-up appointment at the treatment centre. Susan Davis was Sally's nurse and always updated her medical records at the end of each visit. Sally had 15 stitches that were removed 3 weeks after surgery. The wound was then cleaned and dressed. Well, look, I hope you enjoyed this podcast. Please remember to like, share and subscribe to our channels. Till next time, bye for now.